Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada, and my co-host today is Baron Bradley, Operations Manager at Roots Community Health Center. We are reporting for the week of October 19th, 2020. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you the information you can use to make the choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking in 15 minutes every Tuesday morning. Please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. Now, we know that even though this pandemic is worldwide, the effects are very different depending on where you are. So we are here to give you up-to-date information about Oakland and East Oakland in particular. Alameda County now has over 22,500 cases and has 433 deaths. Hospitalization rates remain low, and right now we are seeing them as low as we have seen them since June. Case rates are improving and positive tests are slowing down. We know that with improving case rates and decreasing positive tests, restrictions will begin to be lifted. And as we have seen in other parts of the country, this can lead to cases beginning to go back up again. In fact, new cases and hospitalizations can increase very quickly, so we must stay vigilant. And remember that just because something is open does not mean that it's safe. Oakland still has about 40% of the county's COVID cases, even though Oakland only comprises about 25% of the county's population. Case rates and positivity rates continue to be most concentrated in East Oakland. As we have seen week after week now, 94601, 94621, and 94603 continue to have case rates that are more than triple the rest of the county. And here you see positivity rates in these same three zip codes are also about triple, at 12 to over 14% compared to the county average of 4.1%. So the bottom line is the virus is hitting Oakland worse than any other part of Alameda County, and it's hitting East Oakland even harder. And this is why Roots continues to test a high volume of people in East Oakland. So what are we finding? When we look at all of our positive COVID individuals from late April through mid-October, here is what we're seeing. This graph looks at the most likely source of over 1,200 people who tested positive at our Oakland site. As you can see, household spread is still the main culprit, at 36% of total cases coming from inside the household. Next is through workplace spread. The workplace was identified as the second highest source, accounting for 23% of our positive cases. Third is contracting it from individuals who live outside the home, and fourth is through parties and gatherings. Remember, just because you know someone or they don't seem sick does not mean that you should let your guard down. Now I'd like to drill down further into what we're seeing with regards to workplace transmission. The top sector we identified is construction and other labor at 39.1% of our positive cases. Close behind that is food service and distribution at 32%. And third, at 11%, is warehouse and industrial. Of note, despite being at high risk of exposure to COVID-positive patients, healthcare workers accounted for less than 4% of our positives. So the top three sectors we identified are construction, food service and distribution, and warehouse industrial. If you work in one of these sectors, or really any sector where you work with the public and or you work in confined spaces with others, you need proper personal protective equipment, or PPE. You need a mask, probably an N95, and eyewear as well. Please put them on and keep them on. If you are an essential worker, ask for the proper PPE and keep it on at all times. Your health and the health of everyone in your household depends on it. And remember, just because you're off the clock doesn't mean you can let your guard down. In fact, on your way to and from work, as well as on your breaks, could be the most dangerous times. That's because carpooling and riding public transportation both present a risk, since you're in an enclosed space with others that you do not live with. A mask and eyewear the entire ride is your best bet. Also, break rooms and lunchrooms have proven problematic. Small spaces without proper ventilation, where coworkers are gathering together and removing their masks in order to eat and drink, are risky places. In fact, just last week, the governor of Rhode Island ordered all break rooms to be closed for 90 days because they are experiencing a recent uptick in their cases. Even though there is no such order here in California or in the Bay Area, we still need to take our own precautions. Supervisors should stagger breaks so that individuals are not crowding within these break room spaces. When it is your time to take lunch, consider having your meal in your car or in an outdoor space. At the very least, ensure that you are properly distanced from others and only remove your mask when you are actually eating. As we've said at each briefing, without a cure or a vaccine, the best tools we have are to mask, distance, test, isolate, and contact trace. And now my co-host Baron Bradley, Operations Manager, will go into more detail about operations in COVID time.
Hello, everyone. My name is Baron Bradley. I'm the Operation Manager at Roots Community Health Center. As Operation Manager, my team and I are responsible for the facilities and maintenance. We are also responsible for the security and the safety of our staff and our patients in our community. I also oversee supply inventory and equipment that needed to keep us all safe. As you can imagine, our jobs got a little more difficult when COVID hit. My team increased by about 30% because of all of our new things we need to do because of COVID. Things we used to do now need to be done differently. Everyone now needs special training on COVID safety, cleaning protocols, and PPE, which stands for Personal Protective Equipment. We have to use special outfitted vehicles to transport our members. And we have to make sure there's enough space to avoid crowding at any of our locations. We also have to make sure that their essential workers have places to take their breaks, and they all have the supplies they need to keep themselves and their families safe. As far as cleaning, we now spend about 5 times what we used to spend on cleaning supplies. It's really important that every surface, doorknob, light switch, table, chairs, pens, etc., not only get cleaned, but that nothing gets cross-contaminated. I have staff whose whole job is to wipe things down as they are touched. And then a maintenance crew who comes in at the end of the night to atomize each room with an alcohol-based solution. So it is completely sanitized for the next day. As for PPE, our need for PPE has increased by about 3,000%. It was hard to get our hands on PPE at the beginning of the pandemic, so we are grateful for so many of you donating PPE and working to secure PPE for us. And a special thanks to the County Emergency Operations Center, who has been an awesome partner helping us fulfill our PPE needs. Roots operates 2 community COVID testing sites, one in Oakland and one in San Jose. We designate zones as hot zones and warm zones according to the risk of COVID exposure. Staff have to wear proper PPE that is needed for the zone they are working in. My team works to make sure there is proper spacing between people at the testing sites, so we have cones set up every day. We maintain a flow of people with proper physical distancing so that there are no crowding. And dedicate staff in full PPE, wipe down each surface as it is touched, and make sure everyone stays as safe as possible. We have also set up an outdoor clinic. We also set up an outdoor clinic with our patients to open the air where it is safe. Thanks a lot for your time, and stay safe. Now back to Dr. Noha Abalada. Go ahead, Doc.
Thank you for that, Baron. Now here's our best advice one more time. Remember, COVID spreads easily and rapidly within households. The best way to keep COVID out of your home is not to contract COVID. If you are an essential worker or are conducting essential activities, mask up and space out from everyone, including your coworkers. Avoid confined spaces. This includes carpools and crowded break rooms. And learn to keep your mask and eyewear on. Get proper PPE for your job, and for construction workers and others who will be within 6 feet of especially potentially unmasked members of the public, this might just mean an N95 mask. These masks can be reused so that we save them for healthcare workers, but we need all sectors to invest in the proper PPE for their industry and circumstances. This concludes today's health briefing. Please submit your questions in the comments, direct message us, or send us an email at admin@rootsclinic.org. Please tune in next Tuesday at 10 o'clock, and thank you for watching.